Well, good morning, everybody. My name is Jocelyn Laidlaw. I am the National Ambassador for Colorectal Cancer Canada, and I am also a colorectal cancer survivor. I was diagnosed with stage 3A colorectal cancer in late 2022. Je m'appelle Jocelyn Laidlaw. Je suis l'ambassadrice nationale de Cancer Colorectal Canada et je suis également survivante d'un cancer colorectal. J'ai reçu un diagnostic de cancer colorectal de stade 3A à la fin de l'année 2022. Thank you to the members of the Parliamentary Press Gallery, members of Parliament, health leaders, patient advocates, and Canadians joining us this morning. March is Colorectal Cancer Awareness Month, and in recent weeks, awareness of this disease has risen sharply following two tragic, high-profile deaths. These losses have reminded Canadians of something we at Colorectal Cancer already know. Colorectal cancer does not start at age 50, and neither should screening. Le cancer colorectal ne commence pas à 50 ans. Le dépistage ne devrait pas non plus commencer à cet âge. We are here today for one clear purpose, to call on the provinces and territories to lower the routine screening age for colorectal cancer from 50 to 45. Nous sommes réunis ici aujourd'hui pour un objectif très clair, demander aux provinces et aux territoires d'abaisser l'âge du dépistage systématique du cancer colorectal de 5 ans à 45 ans. Colorectal cancer is the second leading cause of cancer death in Canada, and it is rising in people under the age of 50. When caught early, it is highly treatable and often curable. This morning, we have assembled a panel of leaders, experts, and patients who know this issue firsthand. Barry Stein is the President and CEO of Colorectal Cancer Canada. Dr. Darren Brenner, who will be joining us shortly, is an epidemiologist from the University of Calgary. Dr. Rachel Goodwin is a medical oncologist from the Ottawa Hospital. And we have three Canadians here today whose lives were forever changed before routine screening would have caught their disease. Jennifer Eppel, Michael Groves, and Melissa Groff. We'd like to begin with some comments from our President and CEO, Barry Stein of Colorectal Cancer Canada. Barry.
Thank you, Jocelyn, and for such an eloquent introduction. You've pretty much said it all, and if I might, I'll add just a few words to it. And thank you all for being here today, and for those who are online as well, welcome, and thank you for taking your time to hear about our message today. So every year in Canada, thousands of lives are lost to a cancer that is highly preventable, highly treatable when treated early as well. Yet our screening policies have not kept pace with that. And this is what the doctors and the patients are seeing right across Canada. Since June of last year, Colorectal Cancer Canada has been calling and advocating across the country with our ministers of health and territories as well, provinces right across the country, for one critical change: lowering the screening age in Canada for colorectal cancer from 50 years old to 45. Chaque année au Canada, des milliers de vies sont perdues à cause d'un cancer pourtant largement évitable et traitable lorsqu'il était détecté tôt. Pourtant, nos politiques de dépistage n'ont pas évalué au même rythme que la réalité observée par les médecins et les patients. Depuis juin de l'année dernière, Cancer Colorectal Canada travaille dans toutes les provinces et tous les territoires pour promouvoir un changement essentiel: abaisser l'âge de dépistage systématique de cancer colorectal de 50 ans à 45 ans. We are here today at Parliament Hill to bring national attention to this important issue. While screening programs are delivered by the provinces and territories, national leadership can help accelerate evidence-based prevention policies across Canada. Colorectal cancer remains one of the most serious cancers threatening Canadians from coast to coast to coast. In 2025, an estimated 26,400 Canadians were diagnosed, and it is the second biggest cancer killer in the country when we take men and women combined in these estimates. And 9,100 people, sadly, passed from this disease last year. And what does that mean? That means that every day, 72 Canadians will hear the words, "You have colorectal cancer," and 25 Canadians every day will die from this disease. But the most concerning part And the shift that we're seeing in Canada is who is being diagnosed. Colorectal cancer is increasingly affecting younger Canadians. Le cancer colorectal touche de plus en plus des jeunes Canadiens. Canadians born after 1980 are now 2.5 times more likely to be diagnosed with colorectal cancer before the age of 50 compared to earlier generations. Over the last decade, more than 18,000 Canadians under the age of 50 have been diagnosed with the disease. These are people in the prime of their lives, raising families, building careers, and contributing to their communities. And far too often, their cancers are diagnosed too late because routine screening begins too late. I know this because in 1995, at the age of 41, I was one of them, having been diagnosed with stage 4 cancer to my liver and to my lungs. So lowering the age of screening is not a radical idea. Colorectal cancer is one of the few cancers that we can actually prevent. Screening allows doctors to detect disease early and remove precancerous polyps before they develop. It's an evidence-based prevention strategy already adopted in the United States and Australia, and the modeling shows that earlier screening would not only save lives, it would also reduce the healthcare costs by preventing expensive late-stage treatment. So lowering the screening age to 45 means earlier detection, more cancers prevented, and more Canadian lives saved. Abaisser l'âge de dépistage à 45 ans, c'est une détection plus précoce, plus de cancers prévenus et plus de vies sauvées au Canada. The science est claire, the science is clear, the need is urgent, and the opportunity to save lives is right in front of us. So with that, I'd like to turn it back to Jocelyn for our next guest. In fact, I'd like to turn it over instead of Jocelyn at this point, because Dr. Brenner just walked in, and welcome Dr. Brenner to the podium. Merci et thank you.
Good morning.
Excellent timing.
Oops. Over the past 10 years, over 18,000 people in Canada have been diagnosed with colorectal cancer before age 50. And this number is rising at a rate faster than ever before. Colorectal cancers diagnosed before the age of 50 are most often not diagnosed through screening and are diagnosed at a later, more aggressive stage of disease. As a consequence, nearly 4,000 people have died from colorectal cancer before age 50 in Canada in the past decade. We are seeing a generational shift in the risk of colorectal cancer in younger people in Canada. People born after 1970, millennials and Gen Z, are being diagnosed at more than 2 times the rates of their parents' generations. Although research is underway, the exact reasons for this generational change in cancer risk are not fully understood. But the data tell us there is something we could do. Lower the age to start screening for colorectal cancer to 45 in Canada. Screening for colorectal cancer is a powerful tool. In many cases, it is prevention, as small polyps are detected, removed, before they ever become cancer. Our modeling suggests that starting to screen at age 45 using fecal-based tests, so FIT tests, could prevent over 15,000 cases of cancer from being diagnosed and over 6,000 deaths from happening in Canada over the next 45 years. This is a considerable number of lives that could avoid the negative impacts of a cancer diagnosis. And because we would start screening earlier, many cancers could be prevented at younger ages among working-aged families and people in Canada. Lowering the age to start screening could even lead to a cost savings of over $200 million over the long term. While there would be rising costs from screening more people, these costs would be offset by the rising cost of providing the proper care for those being diagnosed and treated for colorectal cancer. What we see from other countries that have lowered their screening age is that using fit-based screening starting at age 45 is leading to fewer advanced cancers at diagnosis, fewer cancer deaths, and is an appropriate use of scarce healthcare resources. The data suggest that lowering the screening age would have a major positive impact on the population health of Canadians. Thank you.
Thank you, Dr. Brenner. Thank you. So we are very fortunate today to hear as well from a physician who treats colorectal cancer patients every single day. Dr. Rachel Goodwin, as I mentioned, is a medical oncologist at the Ottawa Hospital, and she's here to bring us the clinical perspective on why earlier detection matters, as well as what she's seeing in her practice. Dr. Goodwin.
Thank you. So good morning. Thank you to the Parliamentary Press for allowing me to speak today on this very important campaign and topic. As mentioned, my name is Dr. Rachel Goodwin. I've been a practicing medical oncologist treating colon and rectal cancer patients for about 20 years at the Ottawa Hospital. In my clinical practice, I have seen increasing number of patients under the age of 50 being diagnosed. Approximately 20 years ago, when I started practicing, I would estimate I'd see about 10% of my colon cancer patients who are less than the age of 50. Now that rate is more, in my estimate, around 20% within my practice. Based on my experience in treating younger patients, several important observations stand out to me. First of all, younger patients are often diagnosed at a higher stage of disease, which significantly reduces the cure for these patients. Secondly, many patients in this age group do not recognize the early signs and symptoms of colorectal cancer starting. And even when symptoms do appear, they dismiss these symptoms or they attribute it to something that's less serious. Third, millions of Canadians, including Canadians in their 40s, lack a primary care physician or a primary care provider. So what happens is that without a primary care physician, patients are not able to speak to their care provider about early symptoms, have routine blood work, notice anemia early, and pick up this cancer at a polyp stage, which would be curative. I've witnessed many patients in my practice undergo the emotional impact of being diagnosed with colon cancer at a young age. Many of these patients are in the midst of building their lives. They're working, supporting their families, and contributing to society. Many are raising young children. They're parenting teenagers and caring for aging parents. Managing these responsibilities while recovering from surgery and coping with the side effects of chemotherapy can be extremely challenging. Most importantly and most unfairly, these patients face a world of uncertainty about their future and whether they will survive this disease. So even when the treatments are finished, they do live with anxiety of whether their cancer is going to return. Given what I outlined, I fully support this campaign to reduce the screening age of average risk individuals to 45, and including a public health message to educate patients about the early symptoms of colorectal cancer. Thank you.
Thank you, Dr. Goodwin. Just a very brief introduction on our patients now. Of course, behind every statistic is a real person, a patient fighting to survive, a family facing a devastating diagnosis, lives and careers interrupted, sometimes ended. Derrière chaque statistique se trouve une personne, un patient qui se bat pour survivre, une famille confrontée à un diagnostic bouleversant. Jennifer Eppel was diagnosed with colorectal cancer at age 50, right at the threshold of eligibility, but her cancer had been growing long before that and could have been caught sooner, perhaps even prevented by earlier screening. Jennifer.
Thank you, Jocelyn. Good morning, and thank you for the opportunity to share my story. As Jocelyn mentioned, first of all, I'm Jennifer Eppel. And second of all, when I was 50 years old at the fall of 2020, I was diagnosed with stage 2 colon cancer. During the process of having cancer and being detected, and I was very unaware of the implications that it would have on my life, and I would like to share those with you today. I'm really lucky. My cancer was caught early, and it was treated quickly. It didn't before it spread to my other organs. It stayed within the colon, so I didn't require chemo or radiation. But if I had been screened at age 45, I may not be standing here today as a colon cancer survivor. I may still have my ascending colon, which had to be cut out to remove the tumor. I just turned 50 in the early days of 2020, and my doctor had noticed I hadn't done my FIT test for colon cancer screening. I'd gotten the test in the mail, but I didn't have a family history or any symptoms, and I had not made it a priority. When I sent the test away, it came back as abnormal, and my doctor recommended I get a colonoscopy to see if there was anything to be concerned about. I was not concerned, I wasn't feeling unwell, and I wasn't sick. Waking up from my procedure and finding out that I had a tumor was shocking and, quite frankly, scary. No one wants to hear that they have cancer. My husband and my two daughters, who were 16 and 14 at the time, had to deal with me having a life-threatening illness, had to deal with the word cancer living in our family. For me, the current system worked. Screening at 50, I guess, would be considered a success. While the surgery was a lifesaver, it was still very invasive, and while I wasn't sick when I was diagnosed with colon cancer, I was very sick after the surgery, as I had an infection that took months to clear off. I took 4 months off work post-op to recover. The cost of my surgery may not be visible, and I didn't get the bill, but I'm paying for it all these years later. I will have to have screening every 3 years for the rest of my life, and by screening I mean colonoscopies, not the FIT test. That's no longer optional. While I'm cancer-free for 5 years, the fear of cancer is returning there for me. For my daughters, they had to endure the fear of losing their mother, and now they must worry for their own health. We now have a family history of colon cancer, and my girls will always have that in their background. And there's a cost to the healthcare system for my surgery, for my frequent and invasive screenings. I was told that my tumor was probably growing for 10 years. Imagine if the screening age had been lowered to 45 instead of 50. My tumor wouldn't have grown. It could have been caught as a polyp, and I would have had it removed, and I wouldn't be standing here as a person who had colon cancer.
So our next speaker is Michael Groves. He was diagnosed at age 49, just 1 year before he was eligible for routine screening. Michael Groves a reçu son diagnostic de cancer colorectal à l'âge de 49 ans, seulement 1 an avant qu'il ne devienne admissible du dépistage systématique.
Il y a 5 ans, à 49 ans, j'étais en excellente santé. Je courais, je nageais, j'étais au sommet de ma carrière. Un bref épisode de douleur abdominale et une seule présence de sang dans mes selles ont mené ma médecin de famille à recommander une colonoscopie, même si j'étais considéré à faible risque. En me réveillant de l'examen, on m'a annoncé qu'on avait trouvé une tumeur de 5 cm. C'était un cancer colorectal de stade 3B. 2 semaines plus tard, en pleine pandémie, j'ai subi une chirurgie majeure, suivie de 12 rondes et 6 mois de chimiothérapie qui m'ont forcé à quitter le travail et m'ont bouleversé ma vie professionnelle et personnelle. Et voici la vérité. Si j'avais été dépisté à 45 ans, mon cancer aurait presque certainement été détecté plus tôt. So 5 years ago at age 49, I was healthy, active, in the peak of my career. A brief episode of stomach pain and blood in my stool led my family doctor to recommend a colonoscopy. Even though I was under age 50, probably considered low risk. So when I woke up after the colonoscopy, I was told I had a 5 centimeter tumor. It was stage 3B colon cancer. So within 2 weeks, during the height of COVID, I underwent major surgery followed by 6 months and 12 rounds of chemotherapy that forced me to step away from my work and reshape my career and my life. Through cancer coaching and support groups, I met so many others, many in their 40s, facing the same diagnosis. Some are doing well, some are still fighting, and some are no longer with us. Now, 5 years later, I'm grateful to be cancer-free. My energy levels have returned. I'm rebuilding my career, but I can't help thinking about how different my life would have been if I would have been screened at 45. If I had been screened at 45, my tumor would almost certainly have been found earlier. I might have avoided major surgery. I might have avoided chemotherapy. I might have avoided the emotional, financial, and professional upheaval that came with the late-stage diagnosis. And I'm not alone. Colorectal cancer is rising in people under 50. Doctors know it, patients live it, families feel it. But our screening guidelines have not caught up. That is why we are calling on governments across Canada to recommend lowering the screening age from 50 to 45. And this is not just about healthcare costs, though early detection does save millions. It's about preventing broken families, disrupted careers, and late-stage diagnosis that should not have happened. When I was diagnosed, the medical system moved mountains to save my life. But the truth is, the system shouldn't have to rescue people in their late 40s. It should catch the cancer before it comes a crisis. Lowering the screening age to 45 will save lives. It would have changed mine, and it will change the future of thousands of Canadians who don't yet know they are at risk. Thank you.
Thank you, Michael. Very finally, our final speaker is also the youngest of our patients. Melissa Groff was diagnosed at just 34 years old with metastatic colorectal cancer while she was raising 3 young children and continues to do so. Melissa.
Thank you, Jocelyn. Good morning. My name is Melissa Groff. I am a 36-year-old married mom of 3 from Hamilton, Ontario. Today, I am here as a patient advocate for Colorectal Cancer Canada. I was diagnosed with rectal cancer at the age of 34, and I still can't help but think about those who have to wait until 50 to be screened. In the meantime, I've been encouraging my friends and family to pay attention to their bodies and ask for a colonoscopy if they feel it's needed based on what they experience. The symptoms I had are ones I dismissed as hormonal changes, diet changes, and even hemorrhoids. I am so thankful for my family doctor who was willing to refer me for a colonoscopy when I told her I was experiencing a change in bowel movements and seeing blood on the toilet paper when I had a bowel movement. I didn't leave that colonoscopy without being told by the specialist that I had a tumor in my rectum, and that he took a biopsy and he knew that just by looking at it, it was cancerous. Now, this tumor was described to me as a polyp that became cancerous, but one that just didn't appear overnight. It was there from years ago. Having babies, and imagine, I was living throughout years of planning a wedding, building a house, having babies, all without knowing that I actually had cancer. And then after I had my 3rd child, I started to experience the symptoms the average person experiences and may dismiss. Screening before these symptoms appear can help save lives. After an MRI, CT scan, my first surgery, I was already told I had stage 3 disease. After multiple PET scans, countless CT scans, 6 rounds of chemo, 4 surgeries, a temporary ileostomy, and a hospital visit that took me away from my family for almost 6 days, here I am today, as a stage 4 person with cancer, fighting for my life and fighting for the screening age for colorectal cancer to be lowered to 45 to help thousands of more Canadians. Today, I have friends and family younger than 50 who are reaching out to me to tell me about the polyps they've had removed during their colonoscopies. I wish I knew someone like me more than 3 years ago whose story could have helped change my life sooner. Now, I want to be that person for everyone else and help change their lives. Thank you.
Thank you, Melissa. Well, you've heard the evidence, the clinical perspective, and the human stories behind this issue. Lowering the screening age to 45 is evidence-based, it's cost-effective, and it's life-saving. It has already been adopted in countries like the United States and Australia. Canada cannot fall behind. We are calling on provincial and territorial governments to act on the evidence, lower the routine screening age for colorectal cancer to 45 because it's the right thing to do. Nous exigeons au gouvernement du Canada d'agir en fonction des données scientifiques et d'abaisser l'âge du dépistage du cancer colorectal à 45 ans. We thank you and will now take your questions.
Thank you. To the journalists on Zoom, if you have a question, please use the raise hand function. Pour les journalistes présents sur Zoom, si vous avez une question, s'il vous plaît, utilisez la fonction main levée. Thank you. This concludes the press conference. Merci, c'est ce qui m'a fait à cette conférence de presse.
Merci.
Thank you.
Merci.
Great job, everybody.
Okay.